Hi, everyone. My name is Katie Brumfield, and I'm the manager of career services. And today I am talking with Eva Jackson. Eva graduated from our school in 2018 with her MPH in healthy aging and community health education. Hi, Eva.
Hi,
How are you?
doing all right.
It's
Yeah.
weird because we just saw each other in person.
Yep.
We were just at the American Public Health Association, and it was really fun to catch up with you. So if you could please introduce yourself in terms of where are you working and what is your job title?
Yeah, thank you. Thanks for having me. So I am now working as an associate director with the Healthy Brain Initiative at the Alzheimer's Association. Um, so I get to work from my home in Colorado, but I get to work on the national level doing projects around state, local, tribal public health infrastructure for dementia. Yeah,
I feel like you have the dream job
I
in
love it.
in what you wanted to do. I mean, it's so cool. So how long have you been with the Alzheimer's Association?
I started here about a year and a half ago.
And
Yeah.
before that, I know
Before
what you were doing, but I'd
that,
like you to tell everyone else.
I was doing an ORISE fellowship, Oak Ridge Institute for Science and Education fellowship with CDC's Healthy Aging team.
And that was 1 year or 2 years?
I did that for about a year and a half as
A year and a
well.
half. Okay,
Yeah.
cool.
Mhm.
Um, could you describe a typical day in your role? And I know in public health there it's really hard. There's not a typical day. So maybe like projects you work on or tasks you do daily, stuff like that.
Yeah. Well, so you're right. There's not really a typical day other than emails and meetings, which I feel like everybody does. But I work on two projects right now, two separate larger projects. So one is around developing online interactive curriculum that is for public health students and professionals. It's about public health and dementia. And so for that, I write content. I work with contractors and partners who are developing and building the module. And then I do a lot of work around communication and outreach to share the module. So you saw me doing that at APHA. And then the second project that I work on is our update for our roadmap for Indian country. So the roadmap is a guide for tribal leaders and tribal health organizations who are starting work around dementia in their communities. And so again, I'm working with partners, bringing together leaders in the space, organizing and holding meetings, working again with contractors who are writers and graphic designers and facilitators to make sure that what we're doing resonates and is culturally respectful and appropriate for the tribal nations and communities. It's something that they can see themselves in and want to use. And then I also work a lot with our chapters and our national diversity, equity, inclusion team to support the work they're doing with different tribes. And I get to go to tribal conferences to listen and learn and share resources. So it's kind of a lot of different stuff all over the place, but it falls in those two main buckets, I would say.
Sounds like a lot of project management.
Yes. Yes.
A lot of managing deadlines and email communications and meetings and stuff like that. And that leads me to my next question. What would you say are the top 3 skills you use the most in your job?
Honestly, it's one skill bucket, I would say, which is all forms of communication, like you just said. So whether that's emails, I do public speaking some, I write content. I work with our contractors and our partners and different teams of internal staff. So making sure those relationships are maintained and communication is smooth. And then also designing and developing the outreach products. And we do have a communications team who I work with, but again, trying to make sure that that's all going smoothly. So I will add too, I just have had a lot of other diverse work and experiences that shaped kind of me and what I do. And I didn't ever really know how they were all going to come together. And so you said this is kind of a dream job. This has actually been able to integrate a lot of those different skills and perspectives. So I'm grateful for all of the different pieces because they really do make a difference. But I would say communication skills is the number one.
And I get this question a lot. How do you gain communication skills?
practice,
Yeah.
mentorship. Um,
Yeah.
I've been fortunate to have really amazing supervisors and bosses throughout my career who are really skilled communicators. And so just watching and learning from them, and
Good
asking for
advice.
feedback.
Yeah.
Yeah.
Yeah. Because I think, yeah, you kind of learn your style and you learn what works and what doesn't work by doing.
Yeah,
Yeah.
absolutely.
What, I'm just curious. When you started our program, did you have any idea this is where you would be?
No, I knew I wanted to work with older adults, and I knew I had a background in education. So I knew I wanted to. So healthy aging and community health education, I again was like, oh, this is perfect. This is
Yeah.
what I want to do. And when I graduated, people said, what are you going to do with public health and
Yeah.
aging? Like, what jobs are there? And I said,
Mhm.
I don't know, but I am excited because I think the field is really growing. And
Yeah.
so I feel really grateful that I get to do public health and aging.
Yeah.
Yeah.
And I think working for associations like the Alzheimer's Association, those are great employers for public health professionals.
Yeah. I will mention we are hiring right now. We have 3 open positions. So anybody wants to join our public health team?
Yes, that is amazing. I love to hear that. Um, okay, next question. How did the Colorado School of Public Health help prepare you for this position, including, maybe courses you took or your internship, things like that?
Yes. Yes to all of the above.
Yeah.
I when I think about what I'm doing now, so many of my courses are relevant. Um, and so I had classes in gerontology, which obviously were very relevant working with older adults now. We also did work with local organizations as a part of our concentration. So my capstone project, I worked with senior centers and older adults. And so having some of that local work is really helpful when I then go to the national perspective. It's helpful to know what it actually looks like on the ground. And then the project management, like you mentioned, also evaluation
Yeah.
has been really valuable. I work with all these different projects, and evaluation is really important to all of those projects. And then I would say, surprisingly, I've talked a lot about some of the project management, but biostats and epi classes were
Yeah.
also helpful, because one, for my fellowship with CDC, I did do publications and scientific writing. And then now the content I write is co-branded with CDC, which means that we go through a lot of research and accuracy, taking the science, distilling it down into something that is understandable for folks who haven't done those trainings.
Yeah.
So, and trying to make it something that's impactful. I also did my CHES certification
Yes.
after I graduated, and that's been helpful just with credibility
Yeah.
and the professional support. Um, and then something else I'll add. So I was able to do a GA position. As part of that, I got to do posters at APHA as well as other presentations. And now I'm doing that as a professional. So it's really helpful to have
Yeah.
had that experience. Even if I didn't know that was something I really wanted to be doing later on.
Yeah.
So
Just getting exposed to that and practicing it.
writing an abstract and
Yeah.
making a poster and knowing what to expect, all of that's really helpful.
Yeah. For folks that don't know what CHES is, what does it stand for again?
Community health education specialist. So with the program I did, we did almost all the competencies needed, and so I just had to take an exam after I graduated. And again, at the time, I wasn't really sure what the value or impact was of having that.
Yeah.
But then being working, recognizing, oh, it's valuable for people to know, like she knows what she's talking about when she's doing. So yeah, that was a good choice.
I highly recommend the CHES certification. I see it on job postings, and I just think it's a great credential to have.
Yeah, and the Society of Public Health Educators, Sophie,
Yeah.
that's a place that I have applied to for presentations and continue. So it's also a great network, and
Yeah.
I think it's a fun conference. So
I agree. I agree. I've been to Sophie before. It's a good one for sure. Um, okay. So far in your career, including in your fellowship and in your current job, what has been the most rewarding?
Yeah, so I will say before I did my fellowship, I worked at the county office on aging, and that was very rewarding in general in terms of getting to work with people and see impact. Since I've more working at the national public health level, um, doing my fellowship with CDC's team, I got to publish and present articles. I got to work on the COVID response team. That was all really good. But I think the thing that I feel the most proud of, that's been the most rewarding for me, is something I really didn't see coming. So my supervisor asked me to work on the development of a new national goal for the National Alzheimer's Project Act. It's NAPA. And
Yeah.
so that was established in 2011, and it creates goals for federal agencies to make sure that they are addressing dementia and supporting caregivers and what they're doing. And so this was the first time since then, since 2011, they were adding a new goal.
Wow.
Um, yeah, and I had never had much of an interest in policy. That was not where
Yeah.
I was, looking to work at all. But I got to work with national leaders who look at the science and the public health impact of risk factors for developing dementia.
Yeah.
And then we had all these meetings, we wrote all these documents and spreadsheets, and eventually we did add a sixth goal through HHS Secretary Becerra. He added this new goal to this federal guideline.
That's
And so
huge.
now, yeah, it was really exciting. And I think it just means now that federal agencies have to be working to reduce risk for dementia. And that impacts the whole life course. That's kids, that's everybody. So it like brings everybody into this space. It makes sure that our federal agencies are doing work around that space. And I like, where dementia is doing a lot around science and research for treatment, and all of that's
Yeah.
so important. But I like public health because of the prevention, and that's
Mm,
what this is. And so
that's
it's not
great.
something I saw, but yeah, it's something I'm really proud of been a part of.
Yes. Oh my gosh,
So
that's amazing.
yeah,
That's so
so
cool, Eva. Wow. Um, okay. So on the flip side,
yeah,
what have been some challenges in your career so far?
yeah. Um, I would say maybe growth areas, some places
Mhm.
where I've grown. Um, One area is just I work on a federal grant, so we are CDC funded in my current role, and I really love working with the team we are with at CDC. They're amazing. Working on a federal grant, as you know, I'm sure, comes along with lots of data and reporting requirements. So this goes back to that evaluation, the importance of that.
Absolutely.
Everything, because I'm like, everything we do, you have to be able to report on, and everything that we do, we want to be able to use to validate the grant that we have and have opportunities for the future. So um, I get to travel, which is amazing as part of it. I get to see you and do other work. So I love that. But so that was something I didn't really know a lot about either. So I've just learned a lot about that.
Yeah.
Um, the
Yeah.
other area I'll say is public speaking. So
Mm.
it's always been a struggle for me. But in every role I've had since I graduated, it's something that I needed to do. And so I like telling people what we do, but there's always nerves, and getting over that and remembering why I'm doing what I'm doing is helpful. But
Yeah.
just that has been another, I would say, growth area that I was not expecting.
Yeah. I feel like that's pretty common, when you get into your professional career and when you're asked to speak, it's like, oh my gosh, this is not like a presentation in class. This is like presenting to stakeholders. This is presenting to like the CEO. It's nerve-wracking, but it's awesome because it's such a good skill to have. And it's another one of those things where you just have to keep doing it to get more comfortable with it, and figuring out what works for you. But yeah, public speaking, I had the same problem, not problem, but same challenge, where but
Yeah.
you get a lot more comfortable with it.
And I
um,
would say like the
yeah.
capstone was helpful in that too. I
Yes.
think that was the first time I really had to do that at that level. And
Yeah. Yep.
I'm
Yep.
very grateful since then. I've
Yeah.
done many presentations, and it's always helpful to have something to build on. So
Yes. Yes. Very true. Very true. Okay. Our last question. what advice do you have for people that might be looking to pursue a degree or a career in public health, or people that would like to do a job like you have?
Yeah. There's a few things I can think of. One of them is learning about communication and outreach. So, like we were just talking about, I didn't realize how important that was going to be, to be able to do that thoughtfully and intentionally. We can do as much work as we want, but if we cannot communicate that work to people, then it feels like it's kind of a lost cause. So, being able to communicate that well is really important.
Yeah.
Another thing I would say is I would tell folks to say yes if there's something that feels interesting or exciting, even if it's something that you don't really know a lot about or you want to grow in. So like the national policy, I'm really glad I said yes to that.
I love that. That's
Yeah, and
very good advice.
yeah, I got to do that fellowship, and I didn't know if I wanted to work at the national level, but it was really valuable.
Yeah.
I didn't know if I wanted to do publications, but I'm really glad I did. And public speaking, like I keep applying to conferences and I think I get better. And so just continuing to say yes to stuff because I do think it's valuable.
Yeah.
I think there's maybe two other things. One is I would say rejection is really hard. That's something I've experienced, but I think if you can maintain those relationships, that's really valuable. Or like being open to a little bit of a different journey than you thought you might have. So when I graduated, I did apply for that fellowship with CDC and I didn't get it. And so I worked at the county. I gained a lot of really amazing skills. And then the fellowship position opened up and they actually reached back out and said, "Hi, would you like to apply again?" And so I was able to do that.
Awesome.
And the county job, I think I actually applied for 3 times before I got the job. And by the time I got hired, I was actually hired into the position that was a good fit for me. So, yeah, just thinking like it's hard and it's worth it to keep those relationships and keep trying. Yeah,
absolutely. That is great advice. There's a quote I like that's rejection just means redirection. But I feel like rejection just meant for you, like to keep applying, don't give up because it
do valuable things in the meantime. And
yeah, exactly.
Yeah, absolutely.
Yeah, that's great.
Yeah, when I was at CDC doing the fellowship, I got to work on the COVID response, and part of that was developing guidelines that CDC released around respite care for adult day centers. And I knew about that and cared about that because that was something I had seen when I was at the county. And so just being able to impact change where you're at, a lot of that comes from what you know and have done.
Exactly.
I think the only other thing I would say is feel free to like reach out, connect, network with people.
Yeah.
I did not do that as much when I was in grad school. I did not see the value in that. I was not comfortable doing that. But I think people do like to talk about themselves, clearly here we are. So exactly. I think I'm like, if you want to learn more about what you might want to do, talk to a bunch of people, different people in a bunch of different roles. I did that in my fellowship. I talked to people, all different roles of public health to get a feel for what I might want to do. And there's lots of people who will tell you what you should do, but I think it's helpful to talk to lots of people to figure out what you want to do. So
exactly.
Yeah.
Great advice. Yes. I love when you can really get someone else's perspective in the job to help kind of understand more of what the day-to-day looks like, what it takes to get into the role. Because, there's in public health, it's not like graduate with a public health degree and this is the job you get. Sometimes it can be lots of different steps before you get where you want to go. Or sometimes I talk to alums and they're like, I never thought I'd work here. I never thought I would do this. And it works out. And I think that's
it changes.
Yeah.
And a huge part of that is who you know too, and knowing where you might want to go. So if funding gets changed or it's helpful to move around, or if you're ready for something different, like that's one of the things I like about public health is it's a skill set that allows you to move if you want to.
Yes. So I love that because I don't think we're meant to do the same thing forever.
Yeah.
All right. Well, Eva, thank you so much for sharing your career path with us and what you do
Yeah.
and the amazing work you're doing at the Alzheimer's Association. It's just so awesome. Thank you so much. And I can't wait to see where your career goes from here.
Thank you. Yeah, and we do have a website, a public health website, so and a newsletter. So if folks
Yeah,
want
sign
to
up.
check it out, please do. But
And
thank
then
you.
do
It's
your
been fun.
jobs are on your website?
Yes, our jobs, I think, yes, our jobs are on our website. But you also can reach out. Feel free. It might be an easier way to get a hold of them.
Yeah.
So yeah.
All right.
Well,
Thank
thank
you so
you.
much.